Good afternoon or good evening. Can you all hear me? Well,
Yes.
you can. Okay. I'm going to assume you can hear me, but there is a chat function on here. So hopefully you can access that. Cloud, can you access the chat?
Yes.
Okay, great. So this is the second of at least four webinars, or depending on what happens in Washington, D.C., it may go beyond that. Hopefully not. But thank you for coming. Each week, I'm going to be sharing information that is factual and not fake news or opinions based upon what I've learned over the past week. And, it'll be different next week. What I'm going to tell you is all potentially going to change if Congress comes to some sort of a compromise. Believe it or not, that's what they used to do. But as it stands right now, there are a number of changes that I'm going to talk about tonight. And I'm going to speak slowly and I'm going to try to limit my ands and uhs and thes and but the as I'm more of a insurance nerd than I am a public speaker. But in my mind, I'm the best speaker there ever was. But you know better. If you would please put your name and email address in the chat to be sure that you get the replay and the information on the next webinar. And, I'm not going to do a breaking news thing, but if there's urgent information, I'll be able to contact you. All right. So these are going to go at least through November 12th or longer if Washington District of Grifters, if that impasse continues. And the purpose of these are to share facts and then to share it with you. Now, everything is really up in the air, including things like plan details, premiums, who's eligible, who's not eligible, will premium tax credits be extended? Everything's up in the air. So anything you hear in the news or from friends and relatives, don't waste your time listening to it. Just tune it out because it's all subject to change. Even though we're only about 10 days from the beginning of the November 1st open enrollment. So, a lot is going to happen. And then when the dam breaks, everybody's going to scramble and you're going to leave yourself vulnerable to every kind of scammer and every kind of bad actor should you give them an ear. I believe in the Jordan rule. Michael Jordan was famous, the greatest basketball player of all time, one of the greatest athletes of all time, but yet he never took a political stance because he once asked, "Why don't you take a stance on black causes?" And his answer was, "Well, then I'd lose half of the audience for Nike shoes." And the guy owns, I don't know, 10% of Nike, and is a multi billionaire. Here's what I'm going to cover tonight. I'm not going to go through much of a refresher. You can watch last week's webinar to get that. I've got a lot of news to share, so I'm going to focus on the updates. But I'm also going to talk about what you need to be doing now to get ready for open enrollment. And some of these things are knowing about data matching errors. This is a new acronym that's been dreamed up by Healthcare.gov that could delay your application. There's also differences in citizenship requirements and how you can prepare yourself if you were not born in the US or if you have family members that were not born in the US. I'm going to talk about what I've referred to for 20 years, an unbundling strategy, which is basically underwriting yourself and your family where you balance the cost and the risk. The worst thing you can do is pay too much for an insurance plan and run out of money. Every bit as bad as to get everybody on a lousy stinking plan, which has very little coverage when you have somebody with serious chronic or potentially life-threatening conditions. But I'm going to talk to you about another strategy tonight And that is to stay flexible and to stay calm while Washington works things out. And again, there's a ton of unknowns, and hopefully this will all be unveiled within the next month. But it would not at all surprise me if Healthcare.gov does not open up on time. One of the reasons you saw Amazon Web Services went down this week, and it knocked off Medicare.gov, Health and Human Services, and Healthcare.gov for about 24 hours. And it's very vulnerable. You may recall the first year of when Obamacare came into being, Healthcare.gov in 2014, the website was crippled for 2 months. And it was not well thought out or constructed, but they've had plenty of years to fix it. But at this point, there's a 90% funding cutback in personnel and also in IT in terms of furloughs. So it would not at all surprise me if it comes crashing down. There have been outages over the last day or so that are not have anything to do with AWS problems. So just be calm. We'll get through this. I want to share things that you can be doing now just to get ready. All right. And I want to talk a little bit about my approach. I saw this coming, and I've always looked at things as a challenge. Nobody is going to defeat me. And in spite of commission reductions and eliminations on a lot of my different market segments, I've made a huge investment in my business this year to support my clients. I've got a full-time staff of 3. Claudia Ramirez has been my, I would be putting it, I would be undervaluing her to call her my right-hand person because she is incredible. She can run circles around me mentally and is always 2 steps ahead of me, making great suggestions. And she's also now a licensed agent, and she's also bilingual. She's a personal friend, and her husband is a personal friend who I've known, I don't know, about 10 years. Very trusted and very trustworthy, and the kind of person that I am honored to work with me. I also have a full-time support person who is able to do other things, isn't a licensed agent. Her name is Whaley Bouillard, and she can help in many things and is helping both Claudia and I with many things as well. We actually have a fully functioning website and social media presence that will expand, and I'll talk about that a little bit later. Compliance issues. I've kind of ignored this for a few years, but I am this year. I must record all inbound and outbound phone calls, and you may notice a new email address: mtchapman at TheMedicalInsuranceExchange.com. All inbound calls and outbound calls will be recorded on the office line 214-764-6315. The reason is, if I were to ever have a complaint filed against me, I would be audited, and the first thing they'd ask for is a recording of all the calls, and I have to store those calls for 10 years. So I guess that means I'm going to be alive for 10 years, which is good. Also, you have probably seen there are secure and encrypted links to be able to share your doctor and prescription information. There are so many cyber bad guys in this world that I can no longer ask for or accept this information by email or text message. And I simply don't have the time, especially this year, to take that information by phone. So if you complete the form, it does a couple of things for you for ACA clients or Healthcare.gov or under 65 clients. First of all, you get it to me securely. It's encrypted, so you don't have to worry about it getting stolen. More importantly, though, is you get not only the links to the recording and the upcoming webinars, but I'm also going to be, once open enrollment begins, I'll be working, and Claudia and I will be working to develop plan comparisons according to who's complete this form. So by being on this webinar tonight, you're at the front of the line as opposed to being towards the end of the line. And that's a good thing. And if you get the recording of this, you're not able to make it. I had a lot of people say, I'm working, or I got something going on. When you go through this, make sure you complete the link. It's pretty simple for ACA clients, a retireflow/exchange. There is an area to add comments. I'm asking you, because of some of the non-ACA options, to include your height and weight in the comments area for all family members. Doesn't have to be exact, but the reason is that there are some alternate plans that are valuable for some of your family members who would qualify for non-ACA plans. But those that have serious or expensive pre-existing conditions that have height and weight issues, they would not qualify. It's it's a long list, but that happens. But again, you can do that according to the family members that don't have that as an issue. I've already talked about this. When you complete the form, then you're going to be in the queue, and Claudia and I are working this as quickly as we can. When open enrollment begins, we can't even tell you which doctors and which network or what the plans are or what they're going to cost at the moment. Also, the same thing exists for Medicare. That link will be in the email that was sent out. And also, there are I don't emphasize this enough because of focusing on health, but there's many types of help for not only long-term care, so you can live in your home, but short-term care that can help you or a spouse or both in the event that, let's say, you go into a rehab hospital for one reason or the other, you come out, but you still need help, or your spouse needs help, or you're living alone like me. Well, then there are plans that you can purchase that are affordable, that provide so much money per week or per month to be able to help with living expenses. Now, this is for 2025. These are, and just so you know, if you in Texas, because we did not expand Medicaid, if your income is below this year, this amount, you're not eligible for premium tax credit. And originally, the original Healthcare.gov, if you're prior to the Biden administration, these premium tax credits would it was scaled so that they totally went away when you hit 400% of the federal poverty level. The Biden administration came through after COVID. The Inflation Reduction Act was enacted, and these were expanded out to from 400 to about 600%. They're being scaled, as it stands right now, they're being scaled back to the original levels. Now, what does that mean? If I've already talked about this, you pay the full amount if it's below 100%. If you have children that are under the age of 19 and your income is 150% or less of the federal poverty level, then their application goes to CHIP, Children's Health Insurance Plan in Texas. And what this means, and this is from Kaiser Foundation, all right, very credible source. And this is for just showing for an individual, there's, based on family size, this changes. But the premium tax credits you will see and percentages and also dollar increases, what that does. Now, those that have, this impacts especially families. And I don't see this changing unless Congress requires. I think what's going to happen is, and this is opinion, so keep this in mind, until the midterm elections in November are finalized, everybody's posturing for votes. And it would not at all surprise me if some type of agreement takes place after the elections. Also, I'm using these emails or these webinars as a way of answering questions for everybody. Earlier this week, I had by 2 p.m, I had something like 60 phone calls and texts and emails from Medicare clients and under 65 clients who wanted to, either ask, "Hey, where's my Medicare information?" or wanted to give me their life story. And I can answer questions, and the idea here is to raise everybody's understanding of what the rules of the road are here, and to be able to answer questions based upon what I know at this point in time. I have to get work done, so I can't be answering questions. And I've probably really disappointed or hurt the feelings of many longtime clients over the last couple of weeks who I have not responded to their phone calls and emails or texts, which is not like me. I'm a likable guy in my mind. You may feel differently, but I like to talk to people, and I like to solve problems. I like to help people. But this year is totally different. As I know more, I'm going to share more during these webinars, and we will send an email with links to the recordings and the resources the next day. You'll get this. I don't expect you to be able to read that, but this will be in the email that you get with the recording. Now, here's the first strategy. Let's say you were Ozzie and Harriet. I'm dating myself. Ozzie and Harriet with 2 children, a son and a daughter. One daughter is going to college out of state. You have Ozzie, who has a health condition. Everybody else is healthy and living at home. Well, the unhealthy member, if COBRA is available, that's an option, as is the plans through Healthcare.gov. These are the only plans anywhere that will cover any and all pre-existing conditions and provide wellness benefits and reduce risk with no limits to the top end. There are no other plans. Now, college students, there are major universities will have university plans that usually have a PPO network attached to them that would allow a college student to be covered wherever their school is, as well as when they're back home or when they're on spring break. Out of state family members, they have to be on their own plan. So you have to be unbundling to reduce your risk and cost. As I said at the beginning, the worst thing that could happen is you pay too much. But worse yet is you don't do anything. And I can't tell you I have so many stories I'll share later of people that ran the risk, who did not, who thought they could skirt by and not have coverage, and then they're now living to regret it. So this is really underwriting 101. It's the way health insurance was conducted prior to 2014. You have to manage risk, but in individual insurance, you have to do that by each member of the family. Alternative, I'm going to cover these next week. I'm going to cover MediShare, the Christian Healthcare Sharing Ministry Program. 5 or 6 years ago, prior to the Biden administration's expansion of the premium tax credits, these were very popular. Well, they've become more expensive than they were a half a dozen years ago, relative to the other options. There are also short-term health plan options. I'm going to talk about what the pluses and minuses of those are. Employer health plans and COBRA, if that's an option, and then Medicare. If you are disabled for 24 months on Social Security disability, for 24 months, you're eligible for Medicare Advantage plan until you turn 65, at which point you can enroll in Medicare. In Texas, Medicaid is an option for those that are low income based on household size and income. And there's also a timing problem and a personnel problem because the time it takes to get approved for Medicaid it may be as much as 6 months right now because of cutbacks. So it is an option, but I wouldn't hold your breath on that. CHIP, Children's Health Insurance Program, is an awesome program. Medicaid gives residents of Dallas County and Tarrant County access to incredible health systems. The Parkland here has one of the best burn units in the world, and also one of the top maternity hospitals in the country where people come to learn about these things. Those are options. It's not insurance, but it's access to care. And I have a ton of other resources I'm going to talk about next week, including nonprofit clinics, all right, other prescription savings programs. But the only place where you can get coverage for any and all pre-existing conditions without rejection because of those conditions and have annual wellness benefits at no additional cost are plans through Healthcare.gov and state-based exchanges. I participate in the Georgia exchange, in the in the Illinois exchange, and in the Georgia state exchange. They no longer use Healthcare.gov, and I'm licensed in 17 or 18 states, so I can help other people in other states. Now, I got to tell you, I'm really surprised, but I guess I'm not surprised because everybody kind of ignores the subject until they're getting close to open enrollment time, and the fake news media isn't reporting the facts. They're taking sides. They're talking opinions. They're quoting people that have no idea what's actually going on. But the scammers, agents and non-agents, are out there in force that are selling bad plans. And these are the agents that will be doing something else next year. They get commissions advanced to them, so they're desperate and hungry. And before long, they've dropped out and gotten a real job. Also, I mentioned the 90% funding cuts at Health and Human Services, including Healthcare.gov. The wait times are long already. Plus, their job is to get you in the second lowest cost plan and move on to the next person waiting on hold. And if they don't do enough of those, then they're out. They will be replaced by somebody else, and they're reading from a script from a computer. So, what do you do if you do not have income? One strategy is a Roth conversion or withdrawal, and this is based on 2026 information. Okay, so let's say you don't have any income for 2026. If you qualify for premium tax credit, you have to be at least 100% of the federal poverty level to do so. Well, maybe you don't have a job at the moment, or maybe you don't quite have enough. Well, what you can do is convert some retirement money. You don't have to spend it. You can convert it into a Roth. And the time to do that is when your tax bracket is low. So you could actually do that in November or December of 2026 to basically top off what you need to qualify for a premium tax credit. But you estimate that now in order to meet the minimal level for premium tax credit. On the other side of that, you can decide to clear taxable income in 2025 and live on it in 2026 if that gets you into another bracket and a higher premium tax credit. You can also decide what year a dependent should file taxes on their own or to be part of your household. Sorry, didn't catch that typo. And you can do, dependents up to age 26 can be considered on the household, but it may be to your benefit or to their benefit to be on their own plan in order to for them to qualify for premium tax credit. Here's some other things that are changing. This year, there are 2 open enrollment periods. And I'm going to talk about a special strategy here while I'm on this slide. You have to enroll by December, again, subject to change if they don't roll out on November 1st. But as it stands now, open enrollment will end on December 15th for coverage beginning January 1st. There's a second open enrollment period where you could enroll from December 16th to January 15th for coverage for February 1st. And let me just stop right there for a second before we're going on to the other one. What you may want to consider until Congress is back in session, if it looks like there may be some compromises, they may, in order to get what constitutes a budget, which we haven't had for, I don't know, a dozen years or so, they may decide to expand premium tax credits. Well, you have to, if you want coverage by January 1st, you may not know in time. It may not all be settled by December 15th. I think it will be, but you may want to consider some of the other options. And if you have family members who are relatively healthy, height and weight proportionate, you could purchase a short-term health plan for the month of January and then enroll during the second open enrollment period from December 16th through January 15th for coverage beginning February. So you've got no break in coverage. You have enough coverage to tide over family members. Now, if you're not going to cover, it's not going to cover pre-existing conditions, and there's a chance that some family members, if they're height and weight proportionate, they're not going to be approved. But it is a way of keeping your options open as long as possible while the dust settles here. Also, there are some health plans that could cover some short-term health plans that can cover you for an entire year. I don't recommend doing that because of the limitations in coverage. But again, it's relative to what the plans at Healthcare.gov cost and your other options. You may decide that from a financial standpoint that you want to take that risk for one or more family members. Again, you have to look at it individually and not total. And this is what I do. I make enough to, as an insurance broker. I could have picked many other things to be doing in my 70s that would provide more entertainment. I love helping people and solving problems, and this is my purpose. Yeah, I make enough to get by, but you don't pay anything more for expert advice from one of the top insurance brokers in Texas for Medicare and for under 65. And I do a great job in life insurance. And I'm not, I grew up in Ohio. I'm not one to toot my own horn, but you don't pay anything more for expert advice, for help through enrollment, through sorting through all these decisions, and for support during the year. And let me tell you a couple of other stories from this past 10 days. I get a call a week from Sunday from a lady in New York who has just been diagnosed with cervical cancer. And she is moving to Dallas to stay with friends in hopes that she can be treated here where she used to live and stay with friends. But she doesn't qualify for a special election period. So, I helped her, gave her suggestions. There are contacts at American Cancer Society, how to go about contacting health systems for what is sometimes referred to as charity care. this was like at 7 o'clock in the morning. I take these calls and I help people because it brings it reaffirms my purpose in life. All right. So it's not only you, but it's everybody that I come in contact. This brings me satisfaction, knowing that I'm helping people and not doting on grandkids or dogs or injuring my Achilles tendons playing pickleball 3 times a week. This is what I do, and I've gotten pretty good at it. I will say that, toot my own horn, but I'm here to serve. All right. Now let's talk about federal income taxes. There is a very good chance that if you are in arrears on federal income taxes, you will not be eligible for a premium tax credit or possibly coverage through Healthcare.gov. And also, if you have not reconciled your premium tax credit from 2024 or 2023, you're not going to be approved as it stands now. So you've got to the end of the year to do that. I suggest you get it in because just doesn't. It's not like pushing a button. It takes some time to process all that. Now here's some changes as it stands as of today. Citizens who are legally citizens who were not born in the U.S. and those who are legally present must submit a copy of their documentation. It can be an I-9, it can be a visa, it can be any number of certificates. A Native American's a copy of a tribal certificate. There are many clients here, especially in North Texas, who have Native American ancestry. They have some special programs, but they have to prove it. Also new, there is no coverage anymore for DACA recipients or minors that came in with parents who were non-citizens, and that coverage now ends. There's also many fewer special election periods. These all have to be documented. Death, divorce, which means a decree, a marriage certificate, a birth certificate, proof of loss of coverage, which means if you are you're stunned from a job loss, not only must you have to work on your resume and LinkedIn and all that stuff, but you have to remember to get and hold on to the document from your ex-employer that states, and on company stationery, that says you have lost coverage. If you moved out of a service area, let's say you moved out of state, that's the easy one. Well, then you have to produce a utility bill that shows that new address. Also, there is no more low income special enrollment period. Just about anybody this year up until August, I guess it was, you could blink and get a special enrollment period through any number of ways. And the easiest one was job loss, an income estimate due to job loss. That's gone. So, it's open enrollment or these situations with documentation. Also, you have to pay your insurance premium. If it happens every year, I can see it on my client list, on my book of business, that some people don't pay their November, December premium because they know that the insurance companies have 90 days to before they can cut them off. Well, if you do that, then you won't be able to re-enroll unless you're paid up. Here's something else. Because of funding reductions and also the backlog from COVID times, for long after COVID was no longer a national emergency, there was no checking on who was eligible for CHIP or Medicaid. People just wrote it out. They could stay on it. That ended last year. They're still back up from that. None of the states, Texas, Georgia, any of the states, have the wherewithal in terms of people to process all that stuff. And now with the cutbacks at the state and federal level due to budgets, it's gotten worse. There's also a huge reduction in advertising and outreach funding for Healthcare.gov, and a reduction in navigators and assisters and third-party organizations. That funding is reduced, but it's almost gone. And then also insurance carriers have decided to take the Winston Churchill approach. Never let Never let an emergency go to waste. They have cut commissions and eliminated commissions in many cases. So, I am putting it out there. I am going big. I'm not letting that hold me back. But I know that many clients will, for budgetary reasons, be looking for more economical options, or simply won't have the money this year. And I'm here to serve. I'll advise and assist. And I represent other options besides Healthcare.gov plans, which I'll talk about next week. 2025, if it begins on November 1st, the premium tax credits probably won't get extended, or if they do, it'll be sometime at the end of November. It was very easy for people to qualify for a zero premium silver plan, which had very low out-of-pocket maximums, deductibles, co-insurance, copays. Those days are gone in terms of zero premium. The minimum premium is $5. Also, the plans have a $9,500 out-of-pocket maximum. That's a combination of deductible and co-insurance. Don't be fooled by low deductibles. Look at the total amount of out-of-pocket maximum risk. There are strategies and plans to help fill some of that gap, because I don't know about you, but if one of my sons were to be in an accident, I would do anything for him. All right. But $9,500 would hurt. There are supplemental plans that I'll also talk about next week that will help reduce that first dollar risk. And all of the plans, all of the drug formulators, and I'm hearing rumors and speculation of changes in contracts between healthcare systems and insurance companies, and reductions in plans offered. Aetna's already signaled that they are not going to be offering plans through Healthcare.gov anywhere in the country. And there's also if you completed the form, you noticed a agent of record form at the very end of it, which you digitally sign. That's required for me in order to enroll anybody in 2026 for 2026. Excuse me. So thanks for completing that. Let me get a drink of water here. Okay. Catastrophic plans. There, and this link will be in the recording that comes out. There's a new definition of a catastrophic plan. It is for those people that up until they have been around, but they have only been available for people age 30 or lower. And what they do, they cover basically, it's less than bronze level plan. There's no premium tax credit, but what the administration has done through Healthcare.gov, they're expanding catastrophic plans to make them available for people if they complete a form. The form is at Healthcare.gov. I'm not going to try it. I've got the ability to go to Healthcare.gov and show you who qualifies for catastrophic plan, but it's basically an appeals form that due to job loss or any number of circumstances, if you don't qualify for premium tax credit this year but did in previous years, you want to go now and fill out that form to get ready so that when open enrollment begins, you're not going to be able, you're not going to get a premium tax credit. So if you've been used to that, you're going to pay more, but the longer you wait and getting that form in, and I'll submit it for you, the longer it'll take to get processed. And nobody knows how long it's going to take to process, but it's going to take some time because this takes people, and there's a lot fewer people to do this. So your catastrophic plan, if you submit the appeals form in December, you may not know until February. In the meantime, you're paying a lot of money. So again, there's no idea how long an application will take to be processed and approved, but you might as well get out in front of it, right? If you wait, then you're going to be in the middle of the bulge of people trying to do this. If they hear about it, now's your chance to be on the front end, so you're not waiting forever for this to go through. Also new, next year, all bronze plans are HSA eligible. If you have not had a health savings account before, which is what HSA stands for, it is a way to put money aside on a tax-free basis to pay for out-of-pocket medical, dental, vision, or prescription expenses for any family members. If you're over 50, then you get an additional amount of money. There's more for a family. It's not available for this year, and you can't enroll in a health savings account until you have a qualified health plan, which would begin in January or February, to wait till February. But an HSA is a great way to put money aside for current or future year medical expenses. Let's say you're saving up because you want to have a child in 2027. Having children is expensive. Even with the cost of having a child is, on average, it's about $14,000. Okay, now insurance, $9,500 out of pocket max. You can see you're gonna spend some money, but this is a way to put money aside. It's also a way to put money aside for retirement health care. You can't use it to pay for premiums. You use it to pay for out-of-pocket medical, dental, prescription expenses for you or your family members. And it is a great savings vehicle. It's actually better than an IRA, because with an IRA, eventually, or a 401k, eventually you pay taxes on that money, right? With a health savings account, as long as you use it for medical, dental, or vision expenses, you never pay taxes on the money. You take a tax deduction in the year that you make the contribution, and your parents or your children or relatives can also make a contribution up to the annual limits. And that money grows tax-free until you use it. And if you use it like it's intended, you'll never pay taxes on it. Now, if you use it to buy beer at Kroger, you're going to pay taxes on that money. That's not what it's intended for. Now, I'm going to use some final words here, and this may sound preachy, but man, I tell you, the last week or so, I've heard some real upsetting stories, one of which I shared to you. You have to consider how much risk you can afford versus how much you can afford to spend on insurance per person. And for God's sake, don't let friends or spouses, and don't let cheap friends make healthcare decisions. I run into so many people that want to just think they're going to skip by. Lightning is never going to strike them. Well, it's not just 1 in a million lightning strikes. It's a lot more common than that. Anybody that sees the carnage on the intersections and tollways in Dallas, Fort Worth, or in other areas know that it happens every day, scraping the remains off the pavement. And serious, life-threatening, and debilitating issues that can't be treated because you can't get in to see the doctors or have any treatment unless you just are loaded with money you can afford to pay cash. So never let adult kids make their own health decisions. And for God's sake, don't trust call centers or Healthcare.gov because they're not going to support you when things go wrong. Their job is to put you in a plan and move on to the first one, to the next one. It's not only a financial risk, it's a life-threatening issue. So access to care when you need it most. And this is the perfect example of Murphy's Law or Job if you study the Bible. Things happen. Life events occur when they're least expected to those that are close to you. So, and also don't be too proud to ask for help. That's what I'm here for. You don't know what you don't know, and what you don't know could put you and your family members at risk. So do what you do best. It's not this stuff. I've got 22 years of experience, and this is what I do. This is my purpose. Do what brings you joy, and what gives you the best return on your time invested. And know the difference between opinions from friends or relatives and expert advice. I'm one of the top guys. I'm certified in a number of states. I study healthcare and insurance, and I do this at no cost. Okay. I'm passionate about this. So I'm going to ask you to help me help you. Attend these weekly webinars or watch recordings. Ask your questions. We're going to open it up for the chat for a second here, and limit your phone calls and texts and emails to me. If you complete that form, we will get to you in the order that we receive them. But if I'm spending my time answering phone calls or texts or emails, hey, where's my stuff? Did you get my? I got it. I've got it. I'm going to have to ignore those because several hundred clients are counting on us. Here's how else you can help me. Medicare recordings, so the links to those will also be in the email that you go. The Healthcare.gov emails and recordings and resources, forward them to friends and family members and neighbors. They don't know this stuff. They don't know about catastrophic plans or all these other new rules and regulations that are going to slow them down if they wait until November 1st or whenever it starts. Also, life and short-term, long-term health, if you're interested, I'm not going to mess with those now, or dental and vision, but there are a number of things that I'm going to be sharing through social media, and can work on life insurance and some of the other things after open enrollment. Here's how else you can help me. If you like this, if you find value in this, we actually have social media. I'm one of these guys that was excited to get a calculator in college. So here's how you can help me. Put a review or testimonial on YouTube, Facebook, Instagram. Your friends will see it. We're here to help them too. We're licensed, or I'm licensed in a number of states and can probably help people out of state. Obviously, referrals and inductions. But I also want your comments about how I can make these more valuable, these webinars better for you, and what other topics. I have one topic for people that are coming up on 65 or have worked past 65 that will help them understand what their options are. There are some once-in-a-lifetime options that are available to them that if they miss it, they're going to be subject to the dwindling number of doctors and healthcare resources in this country, or they can make a decision initially when they enroll in Medicare that would enable them to control their access to care and limit their risk. So enjoy the rest of your evening. I'm going to open up this to chat. My goal is to help as many people as I can in each and every day, and I hope you do too. Live with purpose and bring some joy to the world. And that's the end of my sermon for tonight. I'm going to just stop that, and why don't we open it up for questions? You're going to have to unmute yourself too.
I'm going to read a question for you, Mike. Hillary's asking, you mentioned reconciling the premium tax credit and to do it now. How does one do that?
There is a form 8962 You would have received a 1095-A from which would be in your Healthcare.gov account. The Form 8962 is the form that you reconcile the premium tax credit you estimate based on your estimate with what your actual income was for 2024, 2023. And then the easiest thing is to give it to a CPA or a tax accountant, or you can use QuickBooks to file an adjustment.
Does that answer your question, Hillary?
Yes, it's clear as mud.
Probably not the answer you wanted to hear, Hillary, but if I can help you identify that, or either the 1095-A form that would have had your premium tax credit, or locate the 8962, just reach out to me.
I'm putting all the links to the surveys, to the forms in the chat if anyone needs them. For Medicare, for Obamacare, and for life insurance, in case you need it. Any other questions?
Okay, I'm not going to bite, so hopefully, if you don't, I'm not going to take your time, but if there are questions you have, just unmute yourself or put them in the chat, and I'll be happy to answer.
Hey, Mike, this is Shay.
Hey, Shay, how you doing?
Doing well. Thanks again to you and your team for having these webinars. For the Form 8962, did you say that we could find this information in reference to that on our Healthcare.gov account?
Let me clarify. The 1095-A would be in Healthcare.gov. Your
Okay. Okay. All right.
8962, you could Google it, IRS Form 8962, and it'll come right up. It's a PDF. Don't try to reconcile it yourself, but
right.
Get them over to a bookkeeper or CPA.
Okay, thank you.
Mm-hmm.
Anyone else has any questions?
All right, and I'm okay with criticism. So if there are comments that you think I deserve or to make these better, I want to be here to be able to help support you. If there's topics you want to hear, great. I'm going to cover what's newsworthy next Wednesday. Shalacy, you have your hand up.
Sorry, thank you.
Okay. All right. Well, listen, thank you very much. Have a blessed rest of your evening, and feel free to reach out to me. Thank you.